going to ridicule them. She's going to say that the first center, because she senses that this patient is likely to go away from me as well and go in for a third opinion if the second opinion does not work. Obviously, this patient is inclined to have a multifocal or a trifocal implant in his or her eye. So she is going to convince us that she was right in ridiculing them and convincing the patient that being too futuristic is not our call. So we'll go ahead and implant a multifocal, right?
Yes.
Can we have your slides? Shoot, Dr. Nidhie.
A very good evening to all of you. Yes, so I will be talking about we live in the present, and being too futuristic in our approach doesn't deliver the proper treatment. So, Dr. Bain, as I may say, when you say that you don't like rings, I guess that is only when you have to buy them in jewelry form. Otherwise, you are implanting presbyopia correcting IOLs quite a lot, isn't it? So, do you also counsel all your patients choosing these IOLs about the lifetime risk of developing the following posterior segment pathologies? Have you told them about future risk of developing diabetic retinopathy and so on, what you said? Now, the chances of progression of mild to severe NPDR in 5 years is 5.8% only, and the risk for developing macular edema in mild NPDR is 15.6%. Mild NPDR can be controlled by good glycemic control and regular retinal evaluations. So for my patient, preoperatively, I would like to do a FFA to look for extensive CNP areas, do the OCT and look at the macular thickness, and if all is okay, I think I will go ahead with the IOL, multifocal. Talking about contrast sensitivity, would it not happen in a patient who has a monofocal IOL also? In fact, I feel that a sensitized multifocal IOL patient might just present to us earlier if he develops macular edema. Talking about imaging, I think it's the same study in which you said that the image quality was significantly lower, but you did not elaborate that this does not seem to compromise the accuracy of the OCT, which is more important. Coming to the visualization of retina, now the wide field contact lens has made it possible to obtain clearer images of the macular area at multiple focal points in refractive or diffractive multifocal IOLs. These can help in your PRPs and PDTs as well. About your ILM peeling, there was a study in which they showed, I don't think you've read this ever, you can coat the anterior and posterior surface of the IOL with Helon, and using a wide field contact lens and slightly tilting the lens, the visibility will improve. Poor visualization due to rings. Now we have newer EDOF lenses, and here the central area is blended and there is no ring. These kind of IOLs have an extended range of vision from distance to functional near. They have a monofocal-like visual disturbance profile. They utilize all the available light without the energy losses, and the halo profile is also less. So there is no perfect IOL that is equally suitable for all patients, but the right choice in it is an individual, customized approach dealing with patients' expectations. So the lifestyle change should be the patient's choice. I hope this will help. Thank you so much.
Bravo. This was a proper debate. Must congratulate both of you. Rebuttal, Dr. Vibhuti.
I would just say that firstly, the studies that she has quoted, may be influenced with us, the researcher's bias, firstly. And secondly, you cannot depend on, the patient following the doctor guidelines of maintaining a healthy lifestyle. So you cannot depend on a patient's lifestyle, compliance to not create a problem later on with his retina. Yes, mild NPDR can be controlled, but will he follow your restrictions?
Your response, Dr. Nidhie.
Well, I think my presentation is my rebuttal to your question. But you do not know what kind of demands young patients have for near and good intermediate vision. And I think that is also because you yourself are wearing glasses and have not gone for any kind of removal. But the demand is, they are very demanding. You have to look after that as well.
That was below the belt, Dr. Nidhie.
Glasses are above the nose. Come on.
The hit was below the belt.
It doesn't transmit so far. Your question to him, Dr. Nidhie. बाद में देख लूंगी. Yes?
Yes, I have seen him implant the IOL himself, but here for presentation purposes, he is going to monofocal, but I have seen him counsel. Also,
तो चुप करके ले जाना पड़ेगा.
और
I hope this patient never goes back to him at any point of time, because then we will remember this debate even after 10-20 years.
you ensure that he is going to remember it. Dr. Monica, quick comments from, I'll have to select only one panelist because we're a little short in time, sir. If, yeah, Dr.
I think
Monica.
I agree with Dr. Vibhuti. More than 200%. I think patients having any diabetic problems or any retinal problems, we should not go ahead with doing multifocal IOLs. So thank you.
No matter how flashy you get, truth wins.
Go home with helmet.
Just in case you're confused, she is an anterior segment surgeon. Virendra sir, quick comments from you.
Looking to the present scenario and situations, I
And
think
the budget scenario.
present scenario, because she is saying that he is also doing the same. I think just for the fight on the debate side, she took the thing where the people should be with her. So because people are going to implant the same lens, so she has already influenced the decision at home before discussing what to speak by him and her. But definitely, this is not the only point against doing multifocals in diabetics,
Dr. Kelkar.
I think.
No, I agree with Dr. I would definitely put a multifocal, and she put her points across very well. She rebutted everything.
Yeah.
For every question that he raised, she had an answer, and it was scientific and perfect. So I go with you.
Thank you, ma'am.
So that's why I said, according to the house,
Are you amazed with the selection of the panelists by the moderator? One wife supports the husband, other wife supports the wife. This is as neutral as it
We
can get.
are supporting science.
we are
Husband
support.
is, we have tactically kept him away. Thank you so much,
Thank you,
Kashyap.
sir.
Off you go.